Okay, to save paper, I decided to give you the quiz in Edpuzzle, so I'm going to record myself reading through the quiz questions for you. You can answer them in Edpuzzle. I'm going to turn off the video so you can just see my screen. So here you go. Here is the exam. Um, Obviously, you won't need an answer sheet, but here is the exam. So the first part, foundations. A person is responsive and showing signs and symptoms of life-threatening condition, but does not consent to give care. What should you do? A, do not give care, but instead call 911 or the designated emergency number. B, give care and call 911 or the designated emergency number. Do not give care and advise the person to seek medical attention immediately. Give care because consent is not necessary if the person is responsive and has signs and symptoms of a life-threatening condition. I think it's better if I just don't read them and give you time to read or pause the video during the Edpuzzle. So, what are the 3 important steps to following any emergency? Number 2. Number 3, in which of the following situations would you call 911? Select all that apply. Number 4, the first signs of emergency often include which of the following? 5, hand washing and use of personal protective equipment can help lower your risk for infection when giving care. True or false? 6, about how many seconds should you check for responsiveness, breathing, life-threatening bleeding, and or life-threatening conditions? Number 7, you see a woman collapse in front of you while entering the lobby of your office building. You check for her responsiveness, breathing, life-threatening bleeding, and other life-threatening conditions. She is unresponsive and not breathing. What should you do next? When conducting an interview using the SAM method, used to be sample, which of the following questions are part of the SAM approach? Select all that apply. Okay, the second part of the exam, this is the CPR portion. When giving rescue breaths during CPR for adults, children, and infants, about how long should each breath last? Number 2, what is the cycle of chest compressions and breaths in CPR for adults, children, and infants? Number 3, which of the following are the appropriate depth and rate to which to use when giving chest compressions to an infant? You are giving CPR, number 4, you are giving CPR, and the first breath does not cause the chest to rise. What should you do? Number 5, which of the following are the appropriate depth and rate to use when giving chest compressions to an adult? Select all that apply. Number 6, when giving care to an adult or child who is responsive and choking, where should you position your fist to give abdominal thrusts? Number 7, when giving breast to an adult, you should open the airway by tilting the head to which position? Number 8, which of the following are the appropriate depth and rate to use when giving chest compressions to a child? Select all that apply. Number 9, when you give care to an infant who is responsive and choking, what is the correct technique to give chest thrusts? Number 10, when giving chest compressions to a small child, you can use a one-hand technique. True or false? Number 11, which of the following techniques is recommended when giving chest compressions to infants? Okay, number 12, when giving chest compressions to an adult, child, or infant, you should give compressions with the person laying on a soft surface. True or false? 13, what is the appropriate care for an unresponsive choking person? 14, you check an adult, child, or infant and they are not breathing normally, but you hear gasping. You should not give CPR in this case. True or false? 15, when giving breast to an adult, child, or infant, it is important to minimize interruptions to chest compressions to the shortest time possible, but definitely less than which of the following? 16, when giving CPR to a person who is in cardiac arrest due to suspect drowning, it is important to give 2 initial breaths before starting the CPR cycle. True or false? 17. If you are unable or unwilling for any reason to give CPR, chest compressions with breaths, to a person in cardiac arrest after calling 911 and getting equipment, what should you do? When giving two breaths during each cycle of CPR, why is it important to pause between breaths? When giving breaths, sorry, number 19, when giving breaths during CPR, you can lower your risk for infection by using a face shield or pocket mask. True or false? When giving chest compressions, number 20, when giving chest compressions to an adult or child, which of the following are important aspects of your body position? Select all that apply. Okay, using an AED exam portion. When a cardiac arrest occurs and an AED becomes available, it should be used as soon as possible. True or false? Number 2, what is the benefit of early CPR and early defibrillation when an adult, child, or infant is in cardiac arrest? Number 3, once you haven't turned on an AED, you should do which of the following? Number 4, for an adult or child older than 8 years of age or over 55 pounds, where should the AED pads normally be placed? Number 5, if AED pads risk touching each other on the chest of a small child, you can use front-back placement. True or false? Number 6, after giving shock, you should resume compressions and continue CPR until which of the following occurs? Select all that apply. Number 7, it is fine to use adult AED pads on a child or infant if pediatric pads are not available. True or false? Number 8, when there are 2 or more trained responders giving CPR and using an AED, when should responders switch roles? Number 9, while an AED is analyzing, it is important to make sure of what? Number 10, when should pediatric AED pads be placed on an infant? Sorry, not when. Where should AED pads be placed on an infant? Okay, first aid portion. A child burned in their hand in the lunchroom. A child burned their hand in the lunchroom. You should do which of the following? Number 2, which of the following are some of the signs and symptoms of a concussion? Select all that apply. A person is having signs and symptoms of a heart attack. What should you do after calling 911 and getting equipment or telling someone to do so? Number 4, which of the following statements about anaphylaxis is true? Number 5, in what circumstance would it be appropriate to use a tourniquet? Number 6, when using direct pressure to control life-threatening bleeding on an arm or leg, you should do which of the following? Number 7, you believe that a responsive person has a head, neck, or spinal injury. What should you do after calling 911 and getting equipment or telling someone to do so? Number 8, a child is having an asthma attack. What should you do after calling 911 and getting equipment or telling someone to do so? Number 9, if a responsive choking person is too large for you to reach around to give them abdominal thrusts, which technique should you use to give care? This reminds me, I can't remember if I taught this in class or not, so I will make sure I review this before we take the quiz. Number 10, which of the following medications can you assist a family member with administering when you suspect that a person is experiencing an opioid overdose? Number 11, if you suspect a person is experiencing heat stroke, what is the preferred thing you should do immediately after calling 911 and getting equipment or telling someone to do so? Number 12, a person is experiencing life-threatening bleeding from their neck. It is appropriate to use a tourniquet to stop the bleeding in this case. True or false? When an infant is responsive and choking, it is important to give cycles of which of the following? Select all that apply. 14, which of the following are 2 ways to tell if bleeding is life-threatening? Fifteen, when you give back blows to an adult or child who is responsive and choking, how should you position the person? 16, where should you place a tourniquet on a limb of someone who is experiencing life-threatening bleeding? 17, when giving back blows and abdominal thrusts to a responsive choking child who is small, you may need to do what? Number 18, which of the following indicates life-threatening bleeding? 18 and 14 are like the same question. That's silly. Okay, I think that's the end of the quiz.